Hi, I'm Suzanne Turner, and welcome to a podcast delving into the personal narratives within the clinical research industry. Through candid interviews, we'll learn about the personal journeys and motivations of individuals who have chosen this profession, what I like to call their why. This podcast is not just for industry insiders. It's for everyone curious about the human side of healthcare. Beyond the industry's negative reputation, we'll shed light on the dedicated professionals behind clinical trials. Join us as we uncover the heart and passion of those working tirelessly behind the scenes in clinical research. Welcome to Heart of the Trial. Hello, lovely listeners, and welcome to Heart of the Trial, where we dive into the human side of healthcare, highlighting the voices often left out of the spotlight. I'm your host, Suzanne Turner, and today I'm joined by Dr. Jordan Robertson, a naturopathic doctor on a mission to raise the standards of integrative medicine through research, critical appraisal, and real-world impact. We talk about the Confident Clinician platform she founded to help NDs make evidence-informed decisions, the role naturopathic doctors can play in supporting patients' behavior change, and why real-world outcomes demand more than 15-minute appointments and prescriptions. Whether you're new to integrative care or curious how evidence-based naturopathy is evolving, this episode is packed with perspective and heart. I hope you enjoy, and until next time, stay curious and stay compassionate. Well, welcome to Heart of the Trial, Dr. Jordan.
Thanks so much for having me.
I am thrilled. Why don't you start by introducing yourself to our listeners and telling us what it is that you do?
Yeah, so I'm a naturopathic doctor, but my interest and background in research actually starts much earlier than than that professional designation. My background is actually in research inquiry and critical appraisal. Which why does someone whose background in interest in critical appraisal become a naturopathic doctor? That's a really great question. I've always been really interested in how we sort of think about research, how we apply research to actual clinical practice. That's really been my, long-standing interest. I always say that, in academia, we have this luxury of never having to make a decision. And I'm sure we've read thousands of abstracts where at the end it's like, we need more research, which is like well and good when you work in a lab setting. But when you actually sit across the table from a patient, we have to make clinical decisions based on outcomes that are coming from research, and helping equip clinicians to be able to make decisions based on new research. How do we accumulate new research and then use it as a body of work to inform standards of care? This has always been my interest, which is ironic because in naturopathic medicine is where we've always lacked sort of a consensus-based prescribing or standards of care. My mission and my current role is to I own a tech platform that supports evidence-based clinical decision-making for naturopathic and integrative-minded doctors called the Confident Clinician, where we are working towards consensus-based and standard of care style practice for NDs by helping collect the literature and information on evidence-based practice and helping them make good informed clinical decisions, because we've never had that before in that field of medicine.
Okay, so for our listeners, I think I'm saying this right. Can you explain what a naturopathic doctor is? Like, what is that?
Yeah, so depending on where you live, you may have heard of this before or not. The regulations around naturopathic medicine vary state to state, province to province, country to country. So in some states like Oregon, practitioners that have a degree in naturopathic medicine that focuses on nutrition, exercise, behavior change and medicine, behavior medicine, supplements, nutrition, which I said, sometimes herbal medicine, acupuncture. It's practicing some of those like maybe considered complementary and alternative modalities in medicine. Now, some states have full prescribing authority. So if you practice in Oregon, or if you're in Canada and you practice in British Columbia, you may have full prescribing authority, meaning that they can prescribe medications in addition to all of those other modalities. And then I'll say it disintegrates down the line, where there are some states and provinces where there is no regulation, no title protection, and anyone can call themselves a naturopathic doctor. So, but the basis of the education is really around many of those complementary therapies and approaches to health and wellness. Arguably, many of them belong in primary care medicine these days, but that is the sort of the schooling of naturopathic medicine generally focuses on many of those other lifestyle-based modalities.
So you kind of do a combination of what might be like standard medicine along with more natural ways of approaching health.
Yeah, exactly. And I would say maybe 30 years ago, there were many practices in naturopathic medicine that were not rooted in evidence. Now, some of them were correct. They just didn't have evidence at the time, around eating fruits and vegetables and the importance of fiber.
Mhm.
Whereas, fast forward to today, many NDs are practicing in more of that primary care setting where they have the ability and capacity to look at health concerns from a primary care lens. Depending on their scope of practice, they may or may not be able to suggest all of the available solutions for that patient. Let's say a patient with gout, for example, sees an ND. In some states or provinces, they will leave that appointment with medication and a requisition for blood work and nutrition recommendations and maybe vitamin C as a supplement. Whereas if you practice in an unlicensed state or in another province, you may leave with just nutrition recommendations, but with a letter to your family doctor suggesting that you fill in the other parts of your treatment plan with your other primary care provider. So these days, most NDs are practicing at the level of primary care medicine with or without scope, depending on where they live and practice.
Oh, how incredibly interesting. And do you feel like being someone who works in this field, do you feel that it's very necessary for individuals who are pretty much to have like you're obviously a doctor, so having that doctor official type side along with that additional knowledge and support and all? Because like you said, some places they don't have to be licensed.
Yeah, I would say having unlicensed areas is certainly at the disadvantage of the public because, people don't need to even go to school to call themselves a naturopathic doctor. And I think we maybe all agree that that's not a good thing.
Yep.
I think that having regulation and licenseship and whatnot protects the public, and it also gives a lot of clarity and guidance for the practitioners as well. So I see it only as a good thing. Some of the things that's unique about naturopathic practice that I think is quite valuable these days in healthcare is that it's practicing often outside of the conventional system, not just in terms of what is prescribed, but the how. So appointments are
Mm.
longer. Right? Like when I practiced as a
Mm.
naturopathic doctor, my appointment could be as long as I wanted. I wasn't confined by some of the pressures that conventional healthcare operates under right now. So I could have the luxury of talking patients through things like behavior change or doing a deep dive on their medication compliance or things that we know in the research to improve outcomes, right? We know
Mhm.
provider time, we know touch points, contact points, follow-up points, medication review. Like we have so much literature that your relationship with your practitioner improves your outcome, but we often are still operating in a conventional system where practitioners are limited in their time and their capacity to be able to execute parts of medicine that we know to be true to improve outcomes. And so where I always felt so fortunate, and when I think one of the big values that NDs bring to healthcare teams is the ability to help coach patients through behavior change to actually make their conventional healthcare outcomes improved.
Oh wow, that is amazing. Okay, so tell me about how you got to this point because you're obviously a doctor, so you went to school to be a doctor. What was your main goal there and then did it shift, adapt, or was this always the path you were aiming for?
Yeah, I was probably, I mean, I'm a millennial with baby boomer parents, right? Like it was like the ultimate goal was for you to go to medical school. And when I ended up being a bit disenchanted with what I saw as being limitations and challenge of conventional healthcare, I started looking at other areas in healthcare that maybe could have satisfied my desire for innovation, my desire for, I'll say, doing what's right, not what you have to do because of the system that you work inside of. I
Mm-hmm.
started looking at all sorts of different areas in medicine and landed at naturopathic medicine at the time because of the focus on nutrition and exercise, behavior change, things that I thought were, a valuable contribution to people's healthcare. I mean, at that time, I didn't know how hard of a sell all of that is in someone's healthcare journey, but I did, the pie in the sky version of what I thought healthcare would look like. I was like, well, that's where I want to hang out with people. And I didn't really know that it wasn't evidence based when I decided to become an ND. I just made an assumption that we had standards of care, that there were care guidelines, that we had, publications by our association that were going to give us clarity around where we fit in the healthcare system.
Mm-hmm.
And it was only when I graduated that I realized that those things were missing. And I went to McMaster University, which is like, in terms of like undergraduate health sciences education and innovation, it is like such an amazing place to be. And then I didn't have access to those tools and resources in my own profession, which felt really disheartening. So when I decided to build our current system and platform and support for practitioners, it was really to bridge the gap between, conventional standard of practice, which is like consensus based, right? We have committees who sit around and discuss the value and benefits of 500 milligrams of metformin. And then in naturopathic medicine, it was up to each individual practitioner to be in PubMed and looking at all of these resources to try and figure out what to do. I wanted to give them that feeling of standards of care and consensus based prescribing so that we had more of a leg to stand on in healthcare so we could show how valuable and important that work is that we're doing.
Yeah. So what's the overall mission behind it? Like what are you aiming for by having this resource?
Yeah, I really want to improve the standards of care that's delivered by my colleagues. Right. I want them to have a resource that allows them to make great decisions. Like medical decision making is not easy, right? It is not, it sounds cookie cutter. And then you realize that you're like missing three ingredients and the person doesn't actually want half of the suggestions. Like medical decision making is complex. And when we don't equip clinicians with the resources to help them look at, decisions more critically or be presented with all of the possible options for the patient is the one who suffers from that, right? If a doctor is only aware of one solution for the problem, that's a challenge for the patient. And I wanted us to be able to raise naturopathic medicine to having this standard of practice where all of the evidence was there. There was a hierarchy of evidence. You knew what to choose based on your patient's scenario or what the alternatives would be. And so that they were able to have great magnitude of benefit discussions with patients. Patients often walk in and they say, I want something natural for my diabetes. And sometimes that's an appropriate thing to do, and there is a potential to have a similar magnitude of benefit of medications by doing diet and lifestyle. But if we never document that anywhere, if there's nowhere for the practitioner to go and say, by what magnitude can I lower hemoglobin A1C with these solutions versus by what magnitude are we lowering hemoglobin A1C over here with medication, it puts the practitioner in at such a disadvantage because they can't have good consent from their patient if they can't present
Mm-hmm.
literature in that way. The patient
Mm-hmm.
doesn't know that they're choosing an option that's less effective unless we can show them, right, the effect size of various
Mm-hmm.
solutions. And then and basically it creates this it puts naturopathic medicine at odds with conventional medicine rather than the
Mm-hmm.
practitioners being really well equipped with the information they need to make a good decision.
And where do you Like, where does this information come from? Like, is it, the individual doctors putting in, like, yeah, tell me about that.
Yeah. So each topic we review as as a topic. So if we tackle a topic as a organization, it generally takes 30 to 40 to sometimes 100 hours for us to
Mm,
pull together enough of the literature and information that we're confident in the standard that we're bringing to our users or to the
mhm,
clinicians. So it allows us to look at the conventional standards of practice and then also what our role is. So, for not every condition is there an alternative or should there be? So, being really
mhm,
clear about what the role of integrative medicine is in a condition. For some conditions, we can do preventative care, right? Prevent the thing from happening. In some conditions, it's like co-care, meaning that, if you do conventional
mhm.
treatment plus adding exercise, nutrition, supplements, whatever, we enhance outcomes. Sometimes there's an alternative. I would say that that is rare, right? And
Mhm.
often again, that's more of a value-based decision where the patient wants a natural solution. We want to equip our clinicians with what those are, but also that let them have the confidence to say, this herb is less effective than that drug. But if your value is to choose something natural, here's the information on it at the very least, right?
Mhm.
Um, and so having our doctors understand where they fit in the treatment of that particular condition. Are they preventing relapse? Are they keeping medication doses low? Are they preventing the escalation or need of additional medications? If I think of a hypertensive patient, we generally watch them add medication and dose over time. Does adding solutions in lifestyle, exercise, and what have you delay the progression of that patient needing to escalate their
Mhm.
medication? So we've built out where do you fit in this, the world of this condition, and given them all of the literature to support those decisions. So grading the evidence, the magnitude of benefit of each of those choices, how it fits in with healthcare. And then we also take it one step further for how the clinician actually goes about implementing this. How do they
Mm.
monitor their patient? How do they add it in when so much requires behavior change, right? How do we actually
Mhm.
empower the patient to make the change that's needed to make in
Right.
order for them to have this outcome? So when we build those modules, it's coming from peer reviewed content that we've built as an organization. And we've had over 130 doctors work for us in the last year
Wow.
building this reservoir of content. We've been around for 4 years. So we've had,
Yeah.
many, many, many doctors work for us over time. And it's so that we're coming at this sort of peer reviewed data with the highest standard and using a hierarchy of evidence, just as we would for conventional medicine standard of care.
This is amazing. Like, the thing that's standing out to me about this is, from a patient perspective, is you're empowering these physicians to be able to actually customize the treatment they're giving their clients, their patients, versus what most of us deal with when we go to the doctor and here's the issue, okay, here's the thing, and yeah, out the door in 15 minutes type of thing. Like, you're empowering them to figure out for that specific person what the treatment may be.
Yeah, it's interesting. Like individualized medicine, sometimes we get this wrong where we think that like every patient is a brand new, unique snowflake that needs a totally novel solution. Like that's not totally true, right? We have stats, we have statistics that say
Yeah.
that like most snowflakes probably need to do this one thing, right? Where
Yeah.
individualized medicine comes in is that when we make patient centered decisions, we are taking the patient's values, their life. I would say, like a diabetic patient who works night shift probably gets a slightly different treatment plan than a diabetic patient who doesn't, right? Like that's
Mhm.
their night shift will influence their ability to comply. It will influence their nutrition, their ability to exercise.
Mhm.
So individualizing it really is about how do we take the evidence that we have for solutions and integrate them into the individual's life with the individual's
Mhm.
values. It's not that we choose a brand new unique solution for every person,
Yeah.
but if we have the information that shows us what is effective, we can go through that with a patient and say, well, what makes sense for your life, your circumstance, your budget,
Yeah.
your capacity, right? And that's how we make patient-centered decisions. That's not happening in naturopathic medicine without a resource
Mm-mm.
that actually is able to
Mhm.
line up all of the evidence for them.
Oh, that's amazing. That is amazing. Okay, so I'm curious. You mentioned some like challenges earlier. What do you feel is the most challenging part of this? Is it like the patient and getting the patient to comply, or is it like those, and I guess you could say standard medicine accepting that there might be more options?
It's a good question. I would say with like right now, the status of like health and wellness information online, I would say the patients are, they're aware that they have other options, but they're also using TikTok to learn about a lot of those options. And so I think that is, that's a problem, and misinformation is a problem in the health and
Yeah.
wellness space because you can, for all the good work that we do in research and clinical trials, like none of us have like 5 million followers on TikTok. Like we're not the dominant voice right now,
Yeah.
unfortunately. And so there certainly is that. I would say patients are knowledgeable. They're more knowledgeable than they've ever been. It's that their information they have is maybe not accurate. And, as knowledgeable as they are also overwhelmed with information and not able to action a lot of information. Patients are distracted by the amount of information they have. So I'm not sure that
Yeah.
giving them access to ChatGPT and all this information has improved health outcomes yet, because it's a tidal wave of stuff. And quite often we know, and we know this in the research, that like human touch, that organized and structured health, plans create organized, structured health outcomes. And so that I think is a challenge, but I'm sure one that we will overcome. The challenge with like integrating conventional medicine and natural medicine comes down to like, I'll say, a poor PR campaign on our side for naturopathic medicine. And also, if you've had a bad experience with a profession, let's say that, an oncologist, their patient sees a naturopathic doctor, and that naturopathic doctor convinces their patient to avoid chemotherapy, that doctor is going to have a negative feeling about that
Mhm.
profession, because we're not unified as a profession in terms of how we prescribe and how we show up. So it
Mhm.
makes you feel like, oh, naturopathic doctors tell people to stop their chemo, right? Like that's how that may feel to that doctor if that's been their
Mhm.
experience. Whereas our goal is to unify the evidence based
Mhm.
practitioners so that we are showing up with a prescribing standard that oncologists go, yeah, I've worked with an ND and it was amazing. Right? They answered all my patients' nutrition questions. They helped prevent cachexia. They convinced my patient to stay on their chemotherapy, right? Which is what a evidence informed practitioner would do. So I
Mhm.
think that unfortunately, we're still in this place where we're one by one having dialogue with doctors versus having a amazing PR campaign that we can improve the healthcare system, like en masse. But both of those things are challenges, I would say, in my field, the patients and the conventional relationships.
So I have two questions. My first one is, so the confident clinician, your aim is to support the actual clinicians. That's like who you're aiming to help and support, right?
Yeah, yeah.
Okay, awesome. My second question is, if like me as a patient, like Suzanne wants to find a provider that does this, how do patients go about that?
Yeah, it's a great question. And I think, we have a database of our, 800 members who are in our community.
Oh,
And
awesome.
we, quite often get inquiries from the public saying, we're
Yeah.
interested in your work. This is the kind of practitioner I would want to see. Like, who do you recommend, or how can I find
Mhm.
someone? And many
Yeah.
clinicians that practice that evidence-based practice are very that is their brand, because they want to attract patients who want that too, right? Some
Right.
patients are not looking for that. And so it's important that you have alignment with the group of people that you're working with. And I often also recommend for patients that they talk to the practitioner before they work with them, right? Just to figure out
Mm.
if there's alignment around how you feel about the way that decisions are made. What's their connection with conventional medicine and care, and how do they view their role in healthcare? They should be able to like very easily describe kind of those examples I gave. Like sometimes it's prevention, right? Like we don't have a lot of solutions for insulin resistance that are not lifestyle related, right? Like this is a prevention related discussion. Or is it co-management and side effect management and trying to improve outcomes of your current medication? Again, rarely it's a complete alternative to conventional medicine. And if it is, and sometimes we want a total alternative, then we just have to be clear about what the research says. Like, what are you going to get the same outcome with a natural treatment for your acne as you would for Accutane? No, but maybe that's your value to do it that way. And that's great.
Mhm.
We just want patients to make really well informed decisions about it.
Oh, that's awesome. So they can come to your site, like a provider can come to your site in order to get your services and access, and then patients can come to find individuals. That's awesome. Okay, I love that. Okay. Oh my gosh, I had a thought and it ran away from me. Um, oh, okay. I know. I wanted to ask you about like clinical trials. So, are you aware of, or are there clinical trials going on that have some of these like combined things? Does what I'm asking make sense?
Yeah. And I mean, it's always a criticism of clinical trials are hard because we're trying to like isolate down to the one thing that's doing the one thing, right? And
Right.
we do such a great job, or we try to eliminate the amount of like bias and noise that we're seeing in trials through selection and blinding and allocation and all of the things, to get down to like, did this molecule change the outcome for the patient?
Hmm.
When we start to like back up and look at other areas of medicine, like nutrition, like exercise, we have a hard time controlling for the level of things there's my
Yeah.
scientific term, that we are able to control in a drug trial, right? Like,
Yeah.
no one comes into a trial on Crestor taking Crestor. We prevent that, right? Every single person who comes to a nutrition trial already eats food. Like, there's a base, like we can't, right? We can't say we only want the people who don't have any food in their diet to come to this food trial. So there are
Yes.
these like inherent limitations when we start to study whole
Hmm.
body medicine, or we start to study more complex health solutions. Even exercise, as soon as they exercise, now they're in a calorie deficit, and now they have like different hunger cues, and now and we've ruined it from a
Mm.
clinical trials perspective. But
Right. Because
that's
there's no
what that
baseline. Like,
yeah, but that's what that thing
yeah.
does. And
Right.
so in the real world, how do we take what we try and figure out through nutrition and exercise and supplement based trials, and then apply it to clinical care? What we'll
Hmm.
notice in many trials on, we'll say supplements is a great example, is that we only get
Hmm.
outcomes when patients were deficient at baseline, right? If patients have a
Mm.
magnesium deficiency and we give it to them, they feel so much better. But if patients have more than the RDA of magnesium in their life and we give them magnesium, nothing happens, right? And
Mhm.
so
Okay.
you need a different lens of reading clinical trials on nutrition, exercise, supplements than you do looking at biomedical research, because the very basis of building that trial actually is a little different. And then the moment we start to combine something, like we poo poo it, right? From a hierarchy of evidence perspective, we're like, you can't meditate and take melatonin in a sleep trial, because how will we know what worked? And I mean, arguably, that's true, right? From like a pure clinical trial perspective, like study them separately, don't put them together. But when we start to look at real world application of medicine, patients are never just doing one thing, nor would we prescribe that way, right? We would never give them one thing to do and be like, come back in 8 weeks and tell me how you are. We always prescribe in concert with other
Yes.
discussions. And even the visit is a confounder, because the therapeutic relationship makes the patient feel better. So I always want clinicians to have this like lens when they're looking at integrative research, to look at it through the like How do I need to read this like slightly differently in order to make sure I'm interpreting it properly? And then also, how do we take this information and apply it in a real world setting? And can I expect to achieve the same outcomes in a real world setting than I did in this trial? And if we can do those two things, then we're doing much better in terms of evidence-based practice for integrative medicine. But it is a harder thing to pull out of a clinical trial because the baseline status of the individuals makes much more difference because we can't control for lots of it.
Yeah. I love the way you explained that because honestly, I hadn't thought of it that way. So uh, that's incredibly interesting. And do you think that, what are your thoughts with how this goes into the future when it comes to that integrative naturopathic take? Where do you see it going in the future? Do you see it growing because the interest from patients is there? Like you said, like they're finding things out from TikTok and they have all this information. Do you see that side of it continuing to grow?
I hope so. I mean, I love the methods of, like, I'm just a true clinical trial junkie. I love the methods of research, right? And when we look
Yeah.
at how did we get the outcome, so often it's the principles like are embedded in clinical trials that should be in medicine. We talked to them, we answered their questions, we sent them a little video, we called them the next week, we counted their pills to see if they did the thing. Like, when we deliver treatment in a clinical trial, we want the
Mm-hmm.
patients to be so successful at that care because we have this like vested interest in them making it across the finish line. And we build the trial in a way that actually creates accountability, connection, therapeutic relationship, right? Like, we get the nurse to call them every week to make sure
Right.
they did their things. And then we take that information into conventional medicine and we e-fax the pharmacy and tell them we'll see them in 6 months. Right? Like, this is how we deliver it in real life. It's like there are no humans,
True.
there's no pieces of paper, there's no pamphlets, there's no group, there's no nurse that calls, there's no pill counting. We
So
fax
true.
it to the pharmacy and we hope that they do it. And where I see that real benefit of naturopathic medicine in the future of healthcare is that we fill that gap, right? We do
Mm-hmm.
medication compliance support. We help patients understand their condition. We talk through behavior change. We slowly implement a nutrition plan over time, which is how they did it in the clinical trial. They always meet with them every week and layer on new information. That's what we do too. So
That's
I
amazing.
hope that we change because I don't think we're going to hit the health outcomes we want for our countries if we don't start to create this a system of accountability and support for patients to actually make change in their lives. Nobody gets better when we just fax stuff to the pharmacy. They get better through structured human interaction or maybe AI interaction. We'll leave that for another day. But like structured support and accountability. And that is what we do. So I do
Mhm.
see this big role for it. Now, are patients going to buy in that they need to talk to someone every week about their nutrition? I don't know, right? Like, I hope so.
Mhm.
But I do see this huge role for it because that is how we're achieving outcomes in trials. We just don't do it in real life because we don't have it set up as a structure to do it that way.
Yeah. You know, what kind of comes to my mind when you're talking about this is so I'm not diagnosed, but I'm certain I have some ADHD. And one of the things that helps me get things done, I didn't have a name for it until TikTok and all, like, so I am grateful for the
Oh,
knowledge I get for
TikTok can
that.
be good for something.
For some things, yes, yes, yes. Is body doubling. So, like, because I noticed that, like, my sister could hang around and I could knock out stuff like crazy around my house, but no one's there and I can't get myself to get off the couch to do my laundry. You know what I mean? And I almost feel like that's almost what this is. It's having that person there to help keep you motivated and seeing how your progress, that like accountability, that to knowing someone's coming along the journey with you almost is kind of what it feels like when you talk about that. And I'm really curious too, because the other thing that I thought of when you were talking about that is, do do you tend to include, or maybe some do and you don't, or whatever, but the mental side of it, kind of like the therapy side of it? Like, is there something holding them back from being able to do this? Like, do they need to work through that too? Yeah.
Yeah, I mean, I love the evidence for motivational interviewing. And part of why I love that evidence is because we can train doctors like postgraduate in MI
Mm-hmm.
techniques. So you don't have to go back to school to be certified in CBT to be able to help your patients move from, inaction to action. There actually are very easy and clear clinical tools that can be done in a primary care setting that help
Mm-hmm.
patients identify their obstacles, get connected with their motivation, do solution seeking on their own, and then create accountability. Because really, what we're trying to do is create intrinsic motivation over something that has very low reward or low immediate
Mm-hmm.
reward, right? Like, this is why health
Mm,
behavior change
yes.
is so hard. I'm like, can you please eat
Yes.
broccoli? I promise you won't feel any better. That is a terrible proposition for patients. But yet we need them to connect to why they're
Yes.
doing it, what their motivations are, identify barriers, and being able to sustain the habit. For them to be able to like reconnect with someone and work through and troubleshoot how successful or unsuccessful they were. We can train clinicians even if they've been in practice for 20 years, how to question their patients in a way that creates momentum and change and behavior change. And so we do focus on that. And that's one of the things that we've spent a lot of time on in our community is the how, right? And even, one of my favorite types of paper is when papers do reviews of guidelines. I always find that so fascinating when we line up the guidelines like from Japan and Vietnam and, Amsterdam, like wherever, and we look at the differences, like how can a country look at all the same literature but come up with a different standard of care guideline? I find that so fascinating.
That is
And what
interesting.
care guidelines often miss is how do we deliver it, right? How do we deliver the medicine? How do we deliver the care? How often do we see them? How often do we ask them if they went to bed earlier? That's missing in a lot of care guidelines. And that's one of the areas of medicine that I find so fascinating is that we can have a lot of literature for a solution. We know the magnitude of benefit, blah, blah, blah. But then where we let doctors down is like, well, then like, how do you get them to do it?
Yes.
Like, if it's so
Yes.
effective, why haven't we spent any time talking about compliance or how we get them to actually do the thing? So I think that level of training and support for clinicians can be so valuable. And it's not difficult for them to learn it or to implement it in their practices. They just need the tools and the support to do it.
So, what would you say, and this is kind of a broad question, kind of two-sided, like, kind of, if someone out there is thinking about getting into medicine, like, what would you say to motivate them, like, this is a good direction to go? And also, if someone's already in medicine, to like open up their mind to take this in, to add it in, like, that motivational and um, kind of why, how am I trying to say this? Like, truly, like, the rewards they're going to end up getting out of this, I guess you could say, if they take this approach.
Yeah, I mean, I would say it's tough because medicine, I mean, it's such a competitive program to get into. My husband and I both started out as healthcare practitioners. Neither of us currently practice, but we both started out as healthcare practitioners. And he was a dentist. And, we joked, we said they took like the brightest and, with the best marks and the most innovative kids at the time, lined us all up and then put us into the least innovative, least creative, most red tapey job on earth. Right? Like we but that's what happened.
It's so
We have an
true.
entire generation of like taking the brightest uh, people and putting them into the like most least exciting career ever. And we all went into medicine because we wanted to help people, but we didn't realize that
Mhm.
there was so little innovation and so little room for personal development and growth, and
Mhm.
that the system that we were working in was so suffocating, really, in so many
Mhm.
regards. And I adore all of the doctors that I meet, and yet they feel like their practice inside, this like really gross
Yeah.
cardboard box most of the time. And yet they're brilliant and empathetic and excited about medicine, but practice in the confines of a box. And so
Yeah.
I think that's one of the biggest challenges, is that we need innovation in healthcare. And that's truly probably going to come from people that are working on the business side of healthcare and the policy side of healthcare and that
Mhm.
other side, versus like the everyday average clinician. It's hard to move the mountains that need to be moved when
Mhm.
you're, seeing patients for 8 hours a day. It's just really difficult. So I don't know. It's funny. Like when I
Yeah.
interviewed my kids' school, they were like, "Oh, and so many of our graduates go to medicine," and we were like, "No, that's okay. That's not what we're looking for." Um,
Oh my gosh.
We're like, "No, that's not why we're here." But it's because, in our experience, it has taken us leaving practice and being innovative and entrepreneurial and growing something that we truly believe in, because we face so much difficulty doing it in the day-to-day practice of
Mhm.
our work. Now, I know hundreds of clinicians that are able to do both, and they are really changing things in their field, in their subspecialty, in their state or their province, alongside their clinical care. But my experience has been that it was a very difficult dichotomy to be able to do both.
So with that said, what keeps you going? What's your why to this? What keeps you motivated and getting out of bed every morning to keep doing this?
I think for me, I wanted to have a bigger impact. I knew that my skills and capability belonged on a wider scale, to be able to support other clinicians to help their patients. That's, I want them to access research at their fingertips. I want them to have the nutrition for pancreatitis in less than 6 seconds, in a format that allows them to deliver exceptional care at a moment's notice. That really brings me a lot of joy, to think that the clinicians can log in and be supported, and then help the patient on the receiving end, or the patients on the receiving end of all of that information. I think the impact that we're able to have is incredible. If all the doctors that are in our system are all seeing thousands of patients, that means that we're having a really big influence on the state of health and the state of health care all across North America. And I think that's such a cool thing. I also
Yeah.
just deeply love doing critical appraisal. And so when I can
Mhm.
find, and I still do 30% of our critical appraisal inside our
Wow.
organization right now. When I can find that like secret spot where clinicians live to support patients and on a deeper level, let's say, for example, we find that we have no way to test for microvascular changes in patients who have, insulin resistance, and we have no drugs to treat neuropathy aside from pain management, right?
Mhm.
What a beautiful opportunity that is for prevention, right? That if patients and practitioners are aware that we can support insulin resistance, reduce microvascular change, and prevent neuropathy, versus us trying to fix neuropathy that's already happened. I love finding that connection point for clinicians,
Yeah.
to empower them to be excited about what it is that they do. And so that's really what gets me out of bed every morning, is like being able
Yeah.
to do that work and pull together the information that will empower that clinician.
That's amazing. This has been a wonderful, wonderful conversation. It's so insightful for me, honestly, and you've inspired me because like I've gotten more and more into that homeopathic side of myself, like trying to find other ways to make myself feel healthy other than just popping pills, right? And so I love that you're showing me that there's truly a field of doctors who does that combination. And I personally am going to be looking into this for myself. So I hope that our listeners will as well. And before we wrap up, I want to let them know where they can find you. Where can they find you if they want to connect with you?
Yeah, I'm a strong Instagrammer. So you can
Oh,
find me there at Dr. Jordan ND. So like Dr. Jordan ND. Also can find me on LinkedIn, Dr. Jordan Robertson. And then the Confident Clinician resource for clinicians can be found at confidentclinicianclub.com. And that's where you can cruise a free trial and see if that's a practice resource that makes sense for your style of practice and the kind of treatment planning that you want to be able to do with your patients. I do have my own podcast called Real Integrative Medicine, where we do try and break down myths and misinformation in medicine, specifically around the use of integrative medicine in medicine. And so you can also tune into that. We drop a new episode every single week.
Oh, that is amazing. And as someone who's listened to a few episodes, I can say it's definitely worth it. And they're pretty short. So someone who doesn't have a lot of attention span at times, like myself, my brain's going 300 miles per minute. So they're perfectly digestible. So thank you so much, Dr. Jordan, for your time today. It has been amazing. And I really appreciate you.
Yeah, thanks for having me.
This brings us to the end of today's episode. I want to extend my sincere thanks to our guest for sharing their inspiring journey. If you'd like to connect with them, you can find their contact information in the show notes. I also want to express my gratitude to you for joining us on this exploration of the clinical research industry. I hope you found today's episode insightful. If so, please consider leaving a review on your favorite podcast platform. It truly helps us reach more listeners. If you have any feedback, questions, or comments about the show, feel free to email me at podcast@iceconsultingllc.com. Thank you once again, and I look forward to having you joining us on our next episode of Heart of the Trial.